Hello, my name is Gglaser, and my educational video today is going to be about infection control. I'd like to talk about infection control and how it relates to healthcare and the world as we know it today. I'd like to talk about PPE, and my audience is anyone in school from age first grade through high school, adults, healthcare workers, as well as nurses. My goal would be to educate the community, to educate anybody from school, kind of bring it in early and let them take it home to the family, and maybe with pamphlets and educational books, things of that nature. I'm sure we're already doing that since the pandemic has already become an issue. But it's also, I can also see that as a society we become complacent. So this usually pertains to the lack of proper hand hygiene and proper use of PPE, and the overall lack of knowledge that the average person has about the different isolation precautions. It is the systematic way that we don or doff PPE and the correct and utilize proper hand hygiene. It must be done for preventative measures and to protect ourselves from getting sick or having or contracting an infection. Objectives for personal protective equipment are infection control. You do not want to get sick. You want to educate early. You want it to be like a grassroots really soon. Kids know how to wash their hands before and after they use the restroom. That's taught really early by their parents, and as well before and after they eat or drink anything as well. And the pandemic looks completely different than what it did just 6 months ago. The requirements for masks in public places is nothing but a memory. Yet many healthcare facilities, including hospitals, are still treating COVID patients to this day and must adhere to the CDC guidelines and regulations. If they don't do this, they not only risk spreading it to other people within the facility or taking it home to their family, which could really get someone ill, but they're in code violation and can be what they called hit with an injunction by the Health and Human Services Department or the state and federal departments. Cross-contamination is disease prevention. Understanding how the chain of infection works, how to sterilize and clean equipment, and then how to follow the proper isolation guidelines, like contact, standard. Everything as nurses that we know is standard. A lot of places have masks as standard as well now since the pandemic. And the best way to prevent germs like viruses and bacteria from spreading is by interrupting the chain at any link. The number one way to prevent and interrupt the chain is to wash your hands. For school children, after using the bathroom, touching a public door, before you eat or drink something, and always before you touch your face. This would also pertain to some adults. Unfortunately, for nurses, let's remember to foam in and foam out like we are a robot each time we do it. Risk factors and a negative impact that they have on us. Lack of knowledge about personal protective equipment and proper knowledge with infection control, being immunocompromised, or just being a healthcare worker or a nurse are all risk factors and can have negative impacts. It's the lack of knowledge about how the chain of infection works. It's inadequate knowledge about the proper hand hygiene and how to wash your hands the correct way. Nurses must understand the state compliance and CDC guidelines and that they are there for a reason, to prevent the spread of any infectious agent. Preventative measures, personal protective equipment, interrupting that chain of infection, and if you're sick, you need to stay home. Proper knowledge of donning and doffing PPE for healthcare workers is important. Knowing the different isolation precautions like standard, contact, droplet, and airborne precautions, and which PPE applies to them specifically. Also, there is a need for proper infection control practices for the prevention of infection to these individuals, for the proper functioning of the healthcare system as to avoid occupational exposures and dissemination of the infection. Otherwise, be knowledgeable, don't get complacent, and educate your family, friends, as well as co-workers to protect those around you and the community that we all live in. Other preventative measures are to start early with our schools with a grassroots effort about hand hygiene, infection control, the chain of infection, and teaching kids an understanding of germs, which they usually do pretty young. You want to retrain and train all healthcare workers and make sure that they really understand the importance of it. And not only the importance of the preventative measures it is for infection, but to be compliant with the state as well. You can hold in-service trainings for these nurses in these healthcare settings as well, and for all healthcare personnel, especially like your ground level ones like CNAs, rehab techs, and PCTs, who have the most direct contact with a lot of these patients as well. In epidemics of highly infectious diseases such as coronavirus, healthcare workers are at much greater risk of infection than the general population, which is due to their contact with patients' contaminated body fluids. The pandemic has changed the landscape of healthcare, and essentially, it is for the better. CDC guidelines and PPP knowledge saves lives and prevents increased healthcare costs and nosocomial infections from happening and spreading. There are many excellent resources on the internet which are credible and quite knowledgeable. The CDC, the APIC, the WHO, which is the World Health Organization, and another great resource as well is the American Journal of Infection Control, or AGIC journal. There's also a lot more. Just Google community resources. For local, that's what I did for local community resources. There's Travis County, Texas. I live in Austin. There's the Department of Health and Human Services, which is also Austin and federal. And then the U.S. Health and Human Services Department has over 100 programs across its operating divisions, which are programs to protect the health of all Americans and provide essential human services, especially for those who are not able to help themselves. All right, thank you very much. I do appreciate it. My name is Gglaser. This is Community Health 2. Goodbye.